We are the VNA, the Visiting Nurse Association. When someone needs extra help, extra care, extra support, we are there. We help soothe their pain. We help ease their burdens. We help you help them.
VNA is so special because VNA help a whole lot of special people.
We care for our patients as you would care for them, just as you would want to be cared for with individualized, specialized attention.
VNA allows you to really touch one-on-one.
You're talking to the patient, you're touching the patient, you have time to do that.
And because we are invited into their homes, we know our patients. We know their nicknames, their stories, their fears, their hopes, their needs. We know the sound of their laughter, and we know how to wipe away their tears.
This patient, who has been with us for months in hospice, is shy to admit that he doesn't have food.
Our nurses are educators, they're teachers, they can help someone understand.
I would tell you right now, I would use nobody for my own family other than VNA.
We know their families. We treat each patient as the dignified, unique human beings that they are.
So I asked if it would be okay to put out some word about this and see if we could come up with something better than non-perishables from some food pantry someplace that we drop off occasionally.
It is a privilege. To me, it's a privilege because they don't have to allow you into their homes, but they do.
So you become that as a person that they tell you stuff they won't tell their own kid.
Whatever it is that our patients require, be it a short visit, a helping hand, medical assistance, support, and guidance, or even family counseling, we are there.
So I went with this clinical manager to drop this food off to this patient, and when he got to the meatloaf and mashed potatoes, he stood and he held the container, and he looked up at us and went, I could have this for dinner tonight. For the first time in a very long time, in a very dire life situation, has choices.
No matter their finances, no matter their age or race or creed, no matter where they have been or where they are going, we care.
And as we walked down the hall away from him and heard him saying, thank you, Mornay and I went, for the first time in a really long time, maybe ever, this man is wealthy. He has choices. And because of the community that VNA is, we got to make him wealthy at the end of his life.
Just recently I was at a funeral, and after the service, the mother came up and gave me a hug, and she said, you don't know how much you helped.
I've worked for other home care agencies, and coming here, I hope to retire working from here.
Wherever they call home, we are there. Whatever their unique needs may be, we are there. Whenever and however we are needed, we are there.
It really makes a big difference when you have someone that you know is going to be there when you need them and care for you and your family when you need it, and that there's a genuine compassion.
The whole service realm that we offer is focused on keeping the patient at home where they're most comfortable.
We are the Visiting Nurse Association. We care for your loved ones like they are our loved ones, because they are.
We come to you and you get to be with your own things, with your own memories, immersed in your own life, surrounded by the things and people you love. That's a good place to be to heal.
We are the Visiting Nurse Association.